Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Classification. The opioids can be classified as naturally occurring, semi-synthetic, and synthetic. Opioids can also be classified according to the receptor interaction. We have pure agonists. Pure agonists include morphine, pethidine, newer opioids like fentanyl, alfentanyl, sufentanil, and ramifentanil are also seen. Pure antagonists include naloxone, naltrexone, and nalmefene. There are agonists and antagonists, that is, mixed opioids. Mixed opioids include pentazocine, butorphanol, nalbuphine, meptazinol. Then we have partial agonists. Partial agonists include buprenorphine and dezosine.
Classification. First classification is naturally occurring, semi-synthetic and synthetic, whereas the second classification is based on the receptor interaction. We have pure agonists, which are morphine, pethidine, newer opioids like fentanyl, alfentanyl, sufentanil, and remifentanil. Pure antagonists are naloxone, naltrexone, and nalmefene. Then we have agonist and antagonist or mixed opioids, which are pentazocine, butorphanol, nalbuphine, and meptazosol, meptazinol, whereas we have partial agonists, which are buprenorphine and disozine.
thank you and thank you for watching.